Welcome back to another episode of the Lost Book of Herbal Remedies. I'm Alex.
And I'm Emma. Today, we're diving deep into a topic that's still shaping our world, COVID-19. As the virus transitions from a pandemic to an endemic phase, there's a lot to unpack, especially with the new vaccine updates and the long-term effects we're seeing in different populations.
That's right, Emma. It's hard to believe, but COVID-19 continues to evolve, and with that, so do our strategies to combat it. On August 22, 2024, the FDA is set to approve new formulations of COVID-19 vaccines. These are specifically designed to target the latest variants like KP.2 and offer better protection.
These new vaccines are expected to reduce the risk of contracting COVID-19 by up to 70%, and even more importantly, lower the risk of severe illness by up to 90%. With predictions of another big wave in the winter, this could be a game changer for public health.
It's crucial that we stay on top of these developments. Dr. George Diaz, a leading expert, has been advocating for widespread vaccination, especially to protect vulnerable populations. However, there's still some debate about whether everyone needs these new vaccines immediately, particularly younger, healthier individuals who might already have some immunity from previous infections.
And while vaccines are a huge part of the equation, we can't ignore the long-term effects of COVID-19, often referred to as long COVID. Recent studies funded by the NIH have highlighted distinct differences in how long COVID manifests in adolescents compared to younger children.
The NIH study found that while adolescents often report symptoms like fatigue and low energy, younger children are more likely to experience headaches. This is critical information because it suggests that healthcare providers need to tailor their approaches based on age and symptom patterns.
Exactly, Alex. Long COVID can affect nearly every organ system, and with around 20% of school-aged children and 14% of adolescents meeting the research index threshold for long COVID, this is a significant public health concern.
And then there's the issue of avascular necrosis, or AVN, which is emerging as a post-COVID complication. A recent study has shown a potential genetic link between COVID-19 and AVN, where specific genetic markers were more prevalent in those developing this condition after infection.
That's a really concerning development, Alex. The interplay between viral infections and genetic susceptibility is something we're only beginning to understand. This research suggests that genetic profiling might become an important tool in identifying individuals at higher risk for severe post-COVID complications.
And let's not forget about the economic and epidemiological burden of post-COVID-19 conditions, or PCC. A comparative study between Italy and the U.S. has shown that PCC significantly impacts productivity and quality of life, with millions of cases leading to substantial productivity losses.
This study also highlighted the difference in vaccination rates between the two countries, with Italy achieving higher coverage and, as a result, a lower incidence of PCC. It's a reminder that vaccination is not just about immediate protection, but also about reducing the long-term impacts of the virus.
Another significant finding relates to delirium in hospitalized COVID-19 patients. This complication has been linked to factors like age, nutritional status, and elevated D-dimer levels, highlighting the complexity of managing COVID-19 in vulnerable populations.
That's right, Alex. Poor nutritional status, in particular, has been identified as a critical factor in increasing the risk of delirium. This underscores the need for healthcare providers to focus on nutritional interventions as part of the overall treatment strategy.
And on the diagnostic front, recent research has been exploring the potential antiviral effects of vitamin D3, particularly in COVID-19 diagnostics. While the study didn't find a direct antiviral effect, it did show that saliva samples could be a reliable alternative to nasal swabs, which could simplify testing.
Saliva collection is less invasive and often better accepted by patients, making it a practical option, especially in settings where aerosol generation is a concern. It's innovations like these that continue to improve how we manage and diagnose COVID-19.
Now, as we often do on this podcast, let's talk about how herbal remedies can play a supportive role in managing COVID-19 symptoms and boosting overall immunity. While these remedies should never replace conventional treatments, they can offer additional support.
Definitely, Alex. For instance, echinacea is well known for its immune-boosting properties, which can help increase white blood cell production, a vital part of fighting off infections like COVID-19.
and that's just the beginning. Another powerful herb is elderberry, or Sambucus nigra, which is rich in flavonoids that have been shown to possess antiviral properties. Elderberry can help reduce both the duration and severity of respiratory symptoms, making it a strong ally during viral infections like COVID-19.
Then there's andrographis, also known as the king of bitters. This herb is recognized for its potent antiviral and immune-enhancing effects. It's particularly useful in managing symptoms like cough and sore throat, which are common in respiratory infections.
We also have turmeric, with its active compound curcumin, which is well known for its strong anti-inflammatory properties. Curcumin can help manage the systemic inflammation often associated with COVID-19, potentially easing the burden on the body's tissues.
Pelargonium pseudoides, or umcaloabo, is another herb worth mentioning. It's highly effective in treating acute respiratory infections and bronchitis. By helping to clear mucus and reduce bronchial inflammation, it provides significant relief for respiratory symptoms.
Licorice root, or Glycyrrhiza glabra, is another versatile herb with antiviral, anti-inflammatory, and immunomodulatory properties. It's particularly helpful for soothing sore throats and calming coughs, making it an excellent addition to any herbal regimen for COVID-19.
For respiratory support, thyme, or Thymus vulgaris, is invaluable. Its expectorant and antibacterial properties make it effective in relieving coughs and congestion, which are often the most uncomfortable symptoms of respiratory illnesses.
Peppermint, known scientifically as Mentha ex piperita, is another herb that deserves a spot in our discussion. The menthol in peppermint helps soothe sore throats, acts as a natural decongestant, and eases breathing, providing much-needed relief during respiratory distress.
And let's not forget about black seed, or Nigella sativa. Thymoquinone, its active component, offers powerful anti-inflammatory, antiviral, and bronchodilatory effects, making it an excellent choice for supporting overall respiratory health.
Together, these herbs create a comprehensive and balanced herbal remedy aimed at boosting immunity, managing inflammation, and supporting respiratory health, essentially addressing the key challenges posed by COVID-19.
As always, it's important to use these herbs responsibly, in consultation with a healthcare provider, especially when dealing with a complex and serious condition like COVID-19. Herbal remedies can offer significant support, but they should complement, not replace, conventional medical treatments.
So to wrap up, understanding the latest research on COVID-19, including updated vaccines and the long-term effects, is key to navigating the ongoing impact of this virus.
Thanks for tuning in to this episode of the Lost Book of Herbal Remedies.
As always, stay informed, stay safe, and consider integrating natural remedies responsibly into your health regimen.
We hope you found our discussion on COVID-19 insightful and helpful.
And don't forget to subscribe and join us next time as we explore more topics on natural health and wellness.
Until next time, take care.